Hey, welcome to The Explainer. Today, we're going to unwrap the absolutely incredible story of healing itself. Seriously, it's a journey that stretches from ancient potions all the way to futuristic biotech. And the answer? Well, it's a story that's thousands of years in the making. To make sense of it all, we're going to walk through the main stations of change. Think of them as major turning points. This framework is actually inspired by some brilliant material from Dr. Abdul Karim's comprehensive wound care diploma, and it's designed to make this whole amazing history super easy to remember. Okay, let's get into it. So our story really starts with something universal, the timeless wound. I mean, for as long as humans have been around, we've been getting hurt. And every single time, we've faced the exact same three challenges. You gotta stop the bleeding, you gotta prevent infection, and you gotta close the wound. All right, so let's pull into our first station of change. This is where ancient healers, believe it or not, came up with some surprisingly effective techniques. And what's wild is that a lot of what they did, well, it still echoes in medicine today. Just look at this timeline. It's amazing. We're talking way back, 2100 BC, and the Sumerians already had the basics figured out. Wash it, slap on a plaster, and bandage it up. And as we move forward, from the Egyptians using honey to the Greeks using vinegar, you see they weren't reinventing the wheel. They were just refining that same fundamental wisdom. And here's the really cool part. These ancient remedies actually worked. Why? Because they were unknowingly tapping into real scientific principles. Honey, it's a natural antibacterial. The alcohol in wine, a great antiseptic. That grease they used, it created a protective barrier. They were basically practicing good science without even knowing the theory behind it. Pretty incredible, right? But then things took a turn. After the fall of Rome, a whole lot of that practical ancient wisdom just got lost. Wound care didn't just stall. It actually went backward. A new and, frankly, dangerous philosophy took hold. One that pretty much encouraged infection. And this slide just perfectly captures that dramatic, almost unbelievable shift in thinking. For centuries, surgeons actually thought that a wound oozing with thick pus, they called it laudable pus, was a good thing, a sign of healing. Can you believe it? In reality, it was just a nasty staph infection that, if you were lucky, you might survive. Thankfully, this incredibly dangerous idea was eventually thrown out for a return to gentler, cleaner methods. And the guy who really marks this turning point is a French surgeon named Ambroise Paré. Get this, he's on the battlefield, and he runs out of boiling oil, which was the brutal, standard way they cauterized wounds back then. So he has to improvise. He whips up this simple dressing of egg yolk, rose oil, and turpentine. The next morning, he checks on his patients, and wow, the soldiers he treated gently were healing so much better than the ones who got the boiling oil. That discovery, plus him bringing back the practice of tying off arteries, it completely revolutionized surgery. Around the same time, surgeons came up with another crucial concept, debridement. The idea itself is pretty simple, but it's so powerful. To really clean a wound, you can't just cover it up. You have to actively go in and remove any dead or infected tissue. This was a huge shift from just passively dressing a wound to actively managing it. But, even with all this progress, surgeons were still kind of fighting in the dark. Death from infection was still just rampant. They didn't know why. They didn't know the true enemy was a microbe, this tiny, invisible organism that was causing all the sepsis and gangrene that killed so many people. And then Joseph Lister enters the scene. Armed with a brand new germ theory, he finally identified the enemy. And he introduced a weapon, carbolic acid. He used it to sterilize his instruments and to create antiseptic dressings for the patient. The result? It was an absolute game changer. This was the dawn of sterile surgery, and it's our second major station of change. Okay, so you'd think, great, germ theory solved it. End of story, right? Nope. Our third station of change wouldn't happen for another 100 years. And when it did, it went against everything doctors thought they knew about healing. See, for decades, the common sense standard practice was to let a wound dry out and form a big, hard scab. And the logic kind of made sense, right? A dry wound must be a clean wound. It's not a very friendly place for all those germs we were suddenly so afraid of. Seemed logical. Well, it turns out that logic was completely wrong. Mind-blowing research by George Winter back in 1962 showed that keeping a wound moist, it actually doubles the healing speed. Just look at this table. A moist environment lets cells move around more easily, it preserves all those important growth factors, it hurts less, and you end up with less scarring. Everything got better. And that brings us to today, to our final station of change. We've officially moved beyond just creating the right environment for a wound. Now we're actively hacking the body's own code to speed up the healing process itself. I mean, just think about the contrast with that ancient toolkit we saw earlier. It's night and day. We now have things like bioengineered skin that's literally grown in a lab. We have therapies that deliver specific growth factors right where they're needed. We even have smart bandages with tiny sensors inside that can tell you if a wound is getting infected in real time. It's like science fiction. And the future of all this, it's all about precision. We're getting away from that one-size-fits-all approach. The goal now is to use things like genetic markers and detailed wound profiling to create treatments that are totally customized for each individual patient and their specific wound. So, what a journey, right? We've gone from honey and bits of lint all the way to gene therapy. It's an incredible testament to human ingenuity. But you know what? This story is far from over. Which really leaves us wondering, what's the next revolutionary station of change going to be? This whole quest, which started with just a simple bandage, has turned into a deep dive into the blueprint of life itself. And it raises this ultimate question: will we one day be able to heal completely without leaving even a single trace?